Carpal tunnel syndrome is a very, very common problem. It's compression of your median nerve and your wrist. And how that manifests in different people is often numbness, tingling, pain, weakness. It's kind of like a funny pins and needles feeling in your fingers. Most of the time people notice it in the middle of the night because we're all tending to sleep with our wrists like this, and when your wrist is bent like this, your median nerve gets compressed in your wrist. So you wake up and you have to shake your hand out and sort of get rid of that pins and needles feeling in your fingers. But it can also happen when you're driving a car from pushing on the steering wheel. It can happen from reading a book with your wrists flexed or your wrist extended for too long, holding a cell phone for a long time. A number of different things can cause it. A lot of people feel like it comes from typing and mousing and all of those sorts of activities. And while it does manifest in those times, it's not actually caused by that. We don't really know what causes carpal tunnel syndrome. Sometimes it's genetics, sometimes it's diabetes, sometimes it's just random, but what we do know is that it's compression of your median nerve in your carpal tunnel, which is in your wrist. There's a number of different treatments for it. The first line treatment for any carpal tunnel syndrome is to wear a brace. You see people wearing those wrist braces that keep their wrists straight. If you wear that at night, all night, every night, for a period of time, with mild carpal tunnel syndrome, that might be enough to get rid of it entirely because your wrist staying straight keeps the carpal tunnel as wide open as it can be so that nerve doesn't get compressed at night and it doesn't cause you symptoms during the day. If that doesn't work, or if you have moderate or severe carpal tunnel syndrome, the treatments go a little bit more invasive. The next step is often a steroid injection to calm down the inflammation in the area. And if that doesn't work, or if the symptoms are past where we think that an injection might be the solution, surgery is the option. Carpal tunnel surgery comes in two forms. We can do it open, meaning we make an incision on your wrist and open up the carpal tunnel, or we do endoscopic carpal tunnel, which is a much smaller incision in a much nicer place on your wrist, and it's minimally invasive. We use a little camera to cut the carpal tunnel open from the inside and take the pressure off that nerve. A lot of people have a lot of relief immediately after carpal tunnel surgery, and then they have subsequent relief up to a year out from surgery. So if you're having any of these symptoms, it's worthwhile to start wearing wrist braces, see your primary care doctor, but if it's bad enough, it's important to come see us at Nadora Healthcare so that we can talk to you about some of the other solutions for carpal tunnel syndrome.